Morning, everyone. This is Catherine Maloney, one of the co-chairs here at the Southside Wellness Coalition. Happy to see all of you and we appreciate you joining us. We got a full agenda ahead of us. Hopefully we can get through it without any issues. If at any time you have any questions, any concerns, please either in the chat, raise your hand or just take yourself off of mute and we can usually see that you're off of mute. And we can go ahead and call on you. Like I said, I'm Catherine Maloney. I'm with Tri-County Action Agency. And I also run a yoga business here in town. But I'm going to look to my right. And that's probably your left. And right next to me, I'm gonna ask you all to just go around the room and then we'll go through the people on the Zoom call. Steve?
Thank you. Good morning, everybody. My name is Stephen Wilson. We're the Wellness Coalition for probably about 6 years now, I guess. Member of the local recovery community, citizen in Mecklenburg County.
Good morning, everybody. I'm Janet Newman. Here I am.
Welcome, Janet.
Welcome, Janet.
Here I am.
Good morning, everyone. I'm Jenna, Prevention Specialist for Southside Behavioral Health.
All right, and I'm Kenan Tyner-Smith, Fiscal Agent for the Coalition and Prevention Director for Southside Behavioral Health. So I'll popcorn it to Shelley.
Good morning, everyone. I'm Shelley Clary, the Education Specialist at the Virginia Poison Center at BCU Health here in Richmond.
And Brian?
Good morning, everyone. Brian Price with the Virginia Rural Health Association.
I'll popcorn that to Alex.
Morning, everybody. Alex Adler, Virginia Partnership Development with Groups Cover Together.
And Allison.
Hey everybody, I'm Allison Byrne. I'm the Community Engagement and Partnerships Coordinator at the Central Virginia VA Medical Center.
All right, check your microphone a little bit, Allison. It's kind of hard to hear you a little bit. And then Amy. Amy's joined us.
You're on mute, Amy.
She just rolled in from the waiting room. Yeah, she's connected. There she goes.
Hi, sorry.
If you'll introduce yourself and who you're with, Amy.
Oh, okay. Yes. My name is Amy Trent and I work at Virginia Legal Aid Society. We provide free civil legal services to those who qualify. So divorces, protective orders, and the like.
Awesome. Welcome, welcome, welcome.
So first thing on the agenda, everybody in the room has it. Kenan is going to be getting up a copy of that agenda so that we can see it. We're at the point where we're looking at the minutes from the April 17th meeting. If you would be so kind to look through those real quickly. Talks about who's there, the welcome, information on our guest speaker, about the academy, mini academy that Jenna and Jeanette are attending and will continue to attend. And then the updates from the TICN and the coalition members, etc. And then we discussed some training notifications and future meeting topics. If anybody has any questions, now is the time. Any concerns?
Don't ask me why they're rolling up like that.
That's okay.
Something fancy I somehow didn't know I did.
Why are they rolling up like that?
I don't know,
Okay,
but I mean, it's interesting.
pretty cool.
All right, if there are no questions, concerns, or changes to the meeting minutes, I would request a motion to accept the meeting
Mm-hmm.
minutes, please.
Make a motion.
All right, Stevens made a motion. Can I get a second?
I'll second it. The meeting minutes have been first and seconded, all in favor?
Aye.
All opposed? That's passed. Let's go ahead and move on. Next up is a presentation from Ms. Jenna Doe on logic models and the June 20th ADVA training that will be taking place.
All right, I'm just putting up the agenda real quick so folks can see it. Everybody has it in the room. Did you guys all see it online?
Yes.
Thank you.
Alrighty. Kevin, you probably recognize this, slideshow. It's the same one that I presented at the very, very beginning. It's the youth one, but I just keep updating it. Alrighty, I'm just gonna talk about logic models real quick. Cause this is what June 20th is gonna be about, so it's easier if you guys have some background and knowledge. That's not what to do. But this presentation is like 50 slides long. We're not gonna go through all of it, cause it's not necessary.
There your logic model.
There we go.
Started on that slide.
Yeah, from current slide.
There you go.
Alrighty, logic models. So a logic model is essentially just a model that gives the coalition or any organization a roadmap to follow. It's created from a problem analysis, so essentially just a collection of bubbles and figuring out what we want to do, that kind of stuff. It's made up of a problem statement, root causes, and local conditions. And it can be read forwards and backwards. So essentially that the problem statement affects the root causes, affects the local conditions affect the root causes affect the problem statement, if that makes sense. The problem statement is just the overarching goal that you're trying to address. An example would be underage drinking. Root causes are the reasons why the problem statement happened. They're conditions that increase the likelihood of the problem statement. I think some of you have had my presentation on the purpose of a coalition. This little image at the bottom, the host is like the individual. The light color is the environment, which would be our community, which would be Mecklenburg, Halifax, Brunswick. And then the agent is the thing that's happening, right? So that would be like our problem statement. That could be underage drinking. It could be adults drinking. It could be vaping, marijuana, whatever we want. It could be ACEs, mental health. And then the coalition surrounds all of it, but it's touching the environment because we need to affect the environment, which will affect everything else. Make sense? Root causes are specific because they're backed by science. So this is the list of all the root causes that could happen in prevention science. That doesn't mean they're all happening here in our community, but if something's happening, this is one of the root causes and we just got to figure out which one it is or multiple.
So do you have these root causes up here that are specific to your example, or is this the root causes in general?
Yeah, so this is root causes in general. All root causes are going to be one of these. What'll specify it is the research and then the local conditions. So that would be, which actually great segue, thank you. Local conditions are what it looks like in our community. So it's what the root cause looks like. So essentially, if youth are drinking in the park after school, that's what it looks like. We've got our problem, which our youth are drinking. Our root cause could be easy access. And then what it looks like is that they're able to drink in the park after school. Make sense? These need to be specific and they need to be actionable. So essentially that if you can kind of stop it in a sense. An example of what it's not would be youth are drinking because they're stressed. It's too ambiguous. That makes sense. We need like a place, a location, a reason, that kind of thing. All right, the logic model, also needs to have 2 data points for every line. And then the data points, we can have more than 2, but it needs to have 2 and they need to be collected in different ways. So mostly people use focus groups and then double it with anonymous survey, something like that. All data has to have a measure, a data, which is the number, a source, which is who collected it, and then a date of when it happened, so we can make sure it's within the time frame that we're trying to make
Another
change happen.
question. In like, we utilize data that has been done for some other purpose,
Mhm.
but fits our needs. So
Yes,
it's
it's-
nothing we have, so if there was a focus group that addressed some of these issues, we could use the data from that.
Absolutely. The only thing is that, which I'll get into later, is that it needs to be something that can be replicable. So we need to be able to do it over and over again so we can measure our change output. That makes sense.
Mhm.
So like our youth survey that we help out with every year, we can use that. It's not as specific, I think, as we probably need, but like we could definitely use that. And then every 2 years, we measure it again, right? That's what we want to be seeing. Something like trying to figure out like the underage drinking as the problem statement. We only do that almost every 5 years because essentially it moves. It's easier to show you. I'll show you in just a second. Okay, so this is what a logic model looks like. Essentially what I was saying is like, obviously there's 2 data points. This is like our long-term goal. This is intermediate, and this is gonna be as soon as possible, essentially. So the local changes, you wanna see some change between 6 to 12 months. This is like 2 to 3 years. This is 5 to 10. Essentially. Now, obviously, depending on where we are and how much we're moving, that's gonna change. But then that's when we would be collecting data. So for the local conditions, you wanna be collecting it twice a year. We wanna be collecting it if that's, because we wanna be able to see what kind of effect we're making and what kind of changes. For the root causes, like you kind of were asking, that's, yeah, so we would just do that like every 2 years, which could be like the youth. Because they have all those root causes in there. And then the problem would be like every 5 years, or we could do more, yeah.
I'm trying to kind of be on the same page with y'all. Y'all been in this a lot longer than I have, so my brain's trying to catch up and understand where y'all are. It's kind of like working on a car, you know, I learn as I go, and I'm a visual. So as of like what we talked about yesterday, as far as the ACEs thing, could this be interjected into this, what you have here?
Yeah, I'm gonna show you an example of it. So
Okay.
essentially,
Because I'm a visual, you talking to me is kind of like,
right,
I have to see it.
right. So this is kind of the reasons of why we would do something.
Mhm.
And then there's a next section, which is called strategies, which
Okay.
I'm not gonna get into today just because it's
That's
a lot
fine.
to throw at you.
Fine.
But that's where you kind of were going. So
Okay.
for a quick visual for you,
Okay.
and I'll go through it, you would maybe put ACEs up here. Then actually aces would also be here. It's a confusing one.
No, it's okay.
It's a harder
Just,
one.
you're just kind of giving me, throwing out.
And
at
then
me
this
the
would
gist.
be, you're saying, I think we talked about incarceration, so we would say high rates of incarceration for people with ACEs. And then after that, we would go to strategies about what the DA was talking about. Does that
I
make
got you.
sense?
Yes,
Okay,
I'm just wondering if this is something we could throw in here as this.
absolutely.
Okay.
Yeah. Yeah, that's kind of what we're trying to figure out is we need to kind of create this. So we can have a roadmap to where the coalition's gonna go, and we have data points that kind of prove that we're making change in our community. And then it keeps everybody on the same page.
Because it's very much needed in my opinion. That something to do, to change and to help with the ACEs.
Exactly, yeah, absolutely. Let's see, I can't really see it, but. This is just an example, so I talked to the coalition that we have at Halifax High School. And that was last month. And I asked them what the biggest things youth under 18 face in this county. And then some of them came back with a bunch of stuff, but one of them they said was substances, so then we kind of dived into what substances they were talking about. One of them was alcohol, so I'm gonna show you how I put this into a logic model. So our problem statement was youth in Halifax County are consuming alcohol, because that's what they said, right? Easy peasy. Root causes, again, we've got a list. I'm gonna skip. Local conditions, now they told me this, if we go back, you see how I have how, and parents will give, parents have lying around, parties, retailers will sell to youth. Those are your local conditions.
They actually said that.
Yeah,
They're,
That's
they're all
verbatim.
true statements.
More than one.
yeah. So now I've put them under the root causes so you can see. So we've got retailers are selling to youth. That's retail
Mhm.
availability. That's a root cause. We've got alcohol is not stored safely in the homes. That's social availability. And then we also have after school parties. Then parents will give at home. That's favorable parental attitudes. So if we go back, that's the list. That's how I pulled them. Make sense?
Mhm.
So then, this is what it would look like. So we've got the problem statement, which is alcohol, or youth are consuming alcohol in Halifax County. I have my, root causes that are backed up by my local conditions that were specifically told to me by the youth. Cool? Then from there,
Yeah.
we would make strategies, and there's like a 7-list strategy. We will do that next time.
Got it.
All right, that's a plain one. The next thing I'm gonna go into is the goals of the coalition. So essentially, if you wanna think about it, the coalition has 2 goals. Goal 1 is things that don't change behavior, but they're necessary, like, having meetings, doing outreach, engaging in tabling activities that we do, making sure we're present and sponsoring other events, branding, when you guys made your name and also made a logo, that's necessary, but is it changing behavior in the community? No, but you gotta have it. And then pretty much, any kind of education and let's say like town hall meetings, presentations, stuff like that, all necessary. But they don't change behavior. Goal 1 and goal 2 are completely equal. They need to both happen, but you can't have one without the other. Because we can't make change in the community if we're not educating, if they don't know who you are. But if they know who you are and you're trying to educate, but you don't make change, then nothing's technically happening. Make sense? Goal 2 is the logic model. So that's what that's for. That's why we go through all of that and we say, okay, youth are drinking in the park. We're gonna figure out how to stop that. We're gonna do something about that. Make sense?
Moving to goal 2.
Yeah, and you guys have done great, because goal 1, you've checked off a lot. The rule of thumb is to do really only 3 goals, goal 1, a year, just because if we try to do all 6, then that's where you're gonna stay all the time, right? Because there's so much you could do. You can do outreaching and networking all year, essentially.
Well, how do you measure, my big question on goal 1 is, how do you measure the effectiveness? And how do you pick the top 3? And how do you know when they change? Because we have to be able to measure that. We don't, even though you can't measure it against underage drinking is down or availability in the park is not down, where's the most bang for the buck? And we as a coalition have to be able to understand that.
Yes.
And are we tabling at the right events?
Yeah.
Are we, educating the right proper things?
Right.
Because showing up to an event is not the same as showing up and making a difference.
Yes. I agree, 100%. So that's actually, so this is where things kind of get a little messy, because in your strategies, you will do some of goal 1 in your strategies for the logic model. So for an example, I will do this next time, so if I lose you, just stop thinking. But essentially, you've got your logic model, right? So we've done youth, underage drinking, social availability, they're drinking in the park, right? Then we do our strategies, and essentially there's 7 strategies, and one of them can be doing a town hall about consuming alcohol. One of them can be educating teachers. Another one will be having a parole officer at the park. You see what I'm saying? Like, there's so many things, or doing outreach with the schools to make sure, so they can be included and they can be specific to what you're trying to do, which is where you would kind of start measuring stuff, which is what you're talking about. That's essentially how that would kind of work. But you also kind of need to do it in a broader spec for the actual coalition, like all the, outward outreach we're doing. In terms of trying to track that though, I am in the process, which I'm kind of starting now, because you guys have been doing this for like 8 years, is that right? So I'm not gonna go all the way back to the beginning. But from now on, I'm going to have a track of all the things that we have done. So including all of the goal 1 stuff. So every time we get someone new that comes to a coalition, that's gonna be tracked. Every single time we go to a tabling event, that'll be tracked and who comes. Every single time we do a presentation or anything like that out in the community, it will be tracked on an Excel. I can pull that, I think I did share with you.
I don't know.
I don't know.
You
either.
can look. I,
We
and of
can do
course,
that later.
Kenan has access now to like all of our materials for the last 8 years. And like she mentioned, we'll be going back and revisiting some of that. But since we're preparing for the DFC grant,
While y'all are looking for that, I don't know if this is the time or if it will be in like this training that y'all are doing. Are y'all having people go into the actual schools and speak to the students? Or is this something that we would kind of bring up in the training board?
So we do not have a logic model as of right now.
What
so
does that mean
what
to me?
my-
Speaking my
let me
term.
stop
What
sharing
I
for a
just
second.
shared,
Let me stop
we
sharing.
don't have. So essentially,
We've just
we
been
don't have.
attending events, we've
Yeah.
had a strategy to affect all of these things, but we haven't had a strategy specific.
Y'all haven't
to
actually
say,
gone out and done this.
Oh, no, we've done it all.
No,
done
we've
it.
had
Just
a-
have not.
We've had a logic model for prevention. What
Okay,
we're
my
doing
question
now
is, have you got, had
expanding that
anybody
into
go to the school and speak to these students?
At some
And
point-
say,
Where are
hey,
my docs?
that has been in alcohol abuse, that has come out of alcohol abuse, and that says, hey, you know, I understand what it's like to be in it. This is not something you wanna
That
do,
would be where it is.
you know, this
And I
type.
took
like-
my
No,
share down, so. I'm just
That's
sharing
not
back up
been a
with you guys.
strategy, I don't think that we've been able to affect within the school system, it's very tough to get in the
no,
school
it's not.
system.
Yeah.
Of course it
And,
is.
but Jenna is making headways in Halifax, and it's an after-school like function.
Yeah,
And it's
true.
kids
So
who
it's
are
optional.
committed, yes, it's kids who are committed, who want to
Yes,
affect
it's not
the
part of the
community.
school. It's
It's
part
not
of
part of
what they
school.
want to do
We just-
after school.
We just get to use the school,
Yes.
and so this is where we're finding out some of this stuff.
Yeah.
But, no, we've been doing all kinds of prevention-based
Mhm.
things throughout
I
the
got you.
year, and it's
I think-
been part
I think
of
it's
the
crazy.
bigger.
We just want to go to the next level.
I got you. I think it's crazy. They can take out time for pep rallies, but they can't take out time for something like this. But go ahead.
They may, that's, we're gonna make that
Oh,
change, right?
girl, they don't want me to talk about it and get there, but go ahead.
I don't know what that's, there you
I
go.
like all this tracking of, every time we go.
I know,
do
yeah, I
something.
know.
Isn't that gonna make,
Well,
reporting back on grants so much easier? You
well,
know?
I've been tracking everything that we do, but not in an Excel. But I have been tracking
Yeah,
it. It gets
one
tracked every single
spreadsheet,
month
you
in the
can-
board
You
report.
can
I've
answer
been
your
that-
grant
that
responsibilities
stupid.
right out of that.
You can tell the story.
My grant, they'll be fancier, that's for sure.
I have, I was gonna show it to you, but I don't think Kenan has access to it yet, but I have everything on one gigantic Excel sheet now. So all your attendance, all your stuff, and then what you've completed every single year will also be on there too.
I gave her all the stuff that, remember back when McKinsey took all of our minutes and made it
Yes.
huge? Okay, that got turned over to Jenna, and now
Yeah.
Jenna's expanding on that to include everything.
Well, I like it all
Right,
in one anyway. I mean, if you want to find something,
It's right there.
vertical look up something and we'll go. Even if it's
Exactly.
huge, you can find it quickly.
Yeah, that's what I'm trying to do. Pull everything and put it right there. so we can-
Jenna.
Yeah,
Yeah,
find all
yeah.
that stuff. I was just gonna give you another example of goal 1 versus goal 2. I know some of you are familiar with TARP, which is our Trauma Awareness Resilience Partners. So essentially, they've been doing outreaching, public awareness, and general health and safety related activities. So an example would be naming potential partnerships, letters to businesses. Public awareness was that they were gonna do an ACEs training and trying to implement that at schools. And then they also table events and sponsor events, which is what you guys do as well. That's blank. We are not gonna get into that because that is not what you guys are gonna be doing. I think I'm done. Yes.
So do you want to share with them, she's going to be working with the coalition to create a separate logic model from the prevention under me, and then she's going to work with Christine, and the TARP folks to work on a logic model specific for TARP.
And
We
the
think
youth
that's a good
coalition.
time to do that as we're moving to the next funding year.
Yeah.
Okay.
Every organizing group will have a logic model from here on out.
And we've got ours through prevention, which we've already worked through and is due to the state, I think, June 15th. We've got some meetings with them, so ours will be locked in, and then you all will be working on one with a deadline around maybe.
Well, that's what you're gonna be doing on June 20th. So
Yeah.
it'll be a workshop with a professional that's better than me.
No.
To work on.
No.
To work on what you guys wanna do and how to do that in this community. So she's gonna come in, she's a CADCA master trainer, that's who I took the mini academy for, that's how I know this
Who's
stuff.
coming?
Dorothy, what's her last name? I forgot. Her name's Dorothy.
Been a long time since I did the mini academy.
But she'll have some flashbacks, I know, see? That'd be
Five
great.
5 years or more ago.
Yeah, so she'll be helping with that, but I wanted to give you guys this information to help her help you guys, so we're not just learning what a logic model is, we're actually doing it when she's here, because that's gonna be the most helpful. Is her helping create those local conditions, or you figuring out what the local conditions are and the strategies from that point out is what I really want her to do. I will say that also, in all of the stuff that you guys put out, you talk about substance use a lot. I highly suggest that's what you, start with, just because that is the easiest, then move to mental health, ACEs and stuff like that. I will say that TARP is kind of doing that.
Started,
Right
right,
now.
but the ACEs are why the people use.
Substances.
See, the reason I keep talking about it, because I lived all this. From the time I was 15 until 4 years ago, I lived it all, so I can tell you about it all.
Mhm.
Prison, all of it. I can be a witness to you about every single aspect of it. Sexual abuse, the whole 9 yards.
Mhm.
Ask me, I can tell you.
Mhm.
I mean, that's why I'm so passionate about it.
Mhm.
Working on the substance abuse is great. But if you put drugs right there, if I don't touch them, they don't go anywhere. They're not the problem.
Right.
Right, no, right.
No, you're right. So
They
here
are,
is
but
the
they're
thing.
not until you become addicted to them.
No, absolutely.
And I'm not knocking what you're doing, but they're not the problem. It's what's in here that's the problem, seriously.
You're right. Here's the thing about doing ACEs and mental health with a logic model. When we talk about mental health and ACEs, you are not incorrect at all. The problem is it's hard to track. So when we're doing it, we have got to have, I'll go and show you actually. I'll show you.
And I'm not knocking what you're
No,
doing
no,
at all, because some help is better than a zero.
No, you're right. Here's my thing is that so
And the person
ACEs
has to be willing.
and substance use has to have data points that say that they are related. We know that they are factors. We have to know in our community that they are happening at the same time, and we have to be specific. So essentially what we have to do is we'd have to say like, let's just hypothetical, we'll say anxiety and alcohol substance use are directly correlated in our county, right? And then we have to have data points to say that, right? And then we can attack the anxiety or the
Create a
ACEs or whatever it is.
So how do you
Create
get those? Do you
strategy
get it from the
of
people who actually are the substance abuse users?
Yeah, so we would
It's where you would
create,
get it from.
Or
Yeah,
from
we
the
would
people
create a
that
way.
surround them that are affected by it.
Right,
Exactly.
because I'm telling you, I know that it is. There's so many factors to why people.
It
do
is,
this thing.
but then also we
Can't
do
use it as an
have
excuse,
retail
but it is.
availability, we also have social availability, and those are things that we can actually do something about too. The thing too is that a lot of times, things are comorbid, but they're not always direct correlations,
Right.
exactly. And so if we only focus on, we try to say like, oh, everybody has ACEs in our community and everybody has substance use. That's not true, because we have people that
No,
have ACEs
that's
that
not
aren't
true. That's not
touching
true.
substances. And what are we doing about those kids? Or we have people that don't have you know, specific super high ACEs, but they're still touching substances, and then we're not targeting them either. My point is that you just have to be specific, that's all. You're absolutely
Gotcha.
right, but we're just gonna hone in on what ACEs are we talking about? What mental health are we
Mhm.
talking about? What substances, what is the outcome of it, right? We can't just say ACEs and then try to do something about it, because it's just a big bucket of something, right? Like, what is that?
Other health outcomes
Right.
involved with ACEs that are not
Exactly,
substance misuse related.
exactly,
Right.
exactly, and then we're missing all of that too.
So Jenna, let me ask this at a bigger, higher, broader level, you know, the coalition has a bandwidth,
Mhm.
right? We have a bandwidth, we have so many people, so many man hours, whatever. When you create these logic models, are we ranking those logic models and figuring out tier wise which ones we want to tackle in the next 6 months, next year, next 18 months, okay,
Yes.
all right.
What we, so there's
at the iceberg in a sense.
Yeah,
There's
but
two
this is
ways we
what-
can do it, so, and it's totally up to you guys, it's whatever you guys decide with Dorothy, to be honest. If we wanna use her session to just create logic models, multiple, and then we rank them and we start with one. Okay, and then we do one thing, and then we move on. I'm not suggesting that we try to tackle every single substance, every single ACE, every single mental health problem right now, that would be incredibly impossible, and then we would spread ourselves too thin, and there's no point of even doing the logic models. But we can have them up there if we've all got ideas, and then we can move like that. That's why I said I think we should start with substances. Pick one that you guys feel the most passionate about, or feel like that it's maybe even the easiest to do something about, whatever the local conditions are, and then move from there.
Well, I liked what, I mean. My big brain is going, where's our funding? Meaning, if we have funding, we've got to tackle that, even if it might be a little bit lower on the priority list, like just, for example,
Right.
opioids.
Right.
We know we have to deal with the opioid
Right,
crisis.
right.
I don't
Absolutely.
know how big it is in this community compared to where across the United States, across Virginia. But that might be fifth on our list, but it might be something we really need to address
Mhm.
as a close ins because of funding. So I would like to know,
So we
and I
have,
think we
yeah.
should share with,
Yeah.
where's our funding coming from? So that we can tackle those substances, those
A lot of
ACEs,
Ds on
those
that.
whatever that is.
Mhm.
We need to see where that pairs out, and are we attacking our funding sources appropriately?
Yeah.
Cause
Right,
that's that full circle,
Right.
so.
yeah, so here's the thing about that, that's what I wanted to know too.
Okay.
We're in the same boat
Same
there.
line of thinking.
Yeah,
okay.
so, cause I came back and I was like, we gotta know what you have to do first, right?
Right.
We have gone through that.
Mhm.
I will say that the funding sources are specific essentially to the CSB, to me and Kenan. So really, we are covering all of the stuff
Yes.
that is required.
Mhm.
The only thing that you guys have to do is continue to run and do something in your community. That's really it. We have specific sources that we can pull alcohol, marijuana, stuff like that from, but there is nothing that you have to do anymore, because we went through and made sure that we were covering all
As
of
of
that.
FY 26, as of
Yes.
FY 26, which
Well,
is
it's just
coming up,
July,
which is
Mhm.
coming up.
okay.
Yes, we've already, we've done a lot of prep work
Fiscal year
to
20.
make sure that everything is lining up.
Yeah, that we are covering everything that would have to do with funding for you guys.
Right, I understand that, but you also utilize our resources to do some of that work.
Yes,
So-
absolutely.
so-
Well, no,
and
it's in
so-
tandem, it's in tandem.
And so there's what I'm getting at.
Right.
We have, as a coalition, limited resources. We need to help support that
Mhm.
effort in addition to tackling some issues of our own.
Yes.
Okay.
Correct.
So we need to understand, you know, your priority list, I guess, and then decide in tandem what the coalition's priority list is. It's not separate from Southside
Right,
behavioral health.
correct.
You're a fiscal agent, you're driving a lot of our funding, a lot of that. So it has to be, there has to be a merger of those expectations and what you need from us to support your mission. And then we need to figure out what's left over
Mhm.
to support our own growth and activity in the
Right, which is
community.
why we have, let Elena in, please. which is why we want Dorothy to come. Because
Right,
we feel like that now's the time to utilize that opportunity to give you all the time to come up with those strategies. And then align them with the budget for FY '26. Right, yeah, exactly.
As far as the logic model for the coalition itself, a lot of that's common sense. When you look first at what is the greatest need in the community, those are somewhat arguable, but for the most part, that's glaringly obvious. And it's a common sense decision there. And then you get what does the coalition want to do? That one is driven more by, you talked about bandwidth, what kind of man hours we have, but also where our particular talents lie.
Yeah, that's a
good
point,
point.
good
You know,
point.
and that's
Good
gonna
point.
dictate what we address. It's a common sense decision. It shouldn't involve a lot of debate.
Well, we still feel, that the need to be transparent and allow June 20th to be the opportunity for, a member of the coalition to come and be a part of as we're gearing up for FY '26 and gearing up also for the Drug-Free Communities Grant for next year. We really kind of want to get ourselves in line with a 5 to 10 year plan and be able to celebrate something we clearly want to say, this is active change. That we were goal 1, now we've got some goal 2, and you can go to goal 3 today, but then ultimately pulling that out so that we become a recognizable change agent. And also with that youth coalition, like that's part of what we also want to talk to Dorothy about, I think on the 20th. Just talking about sustaining that group, because that's new for me, that's new for Jenna. We want to also
was
make
new for
sure.
the coalition.
Yes, well, I mean, for all of us,
Yeah,
yes.
I mean,
I say me, well,
and
yes,
then how can we replicate that with limited resources?
yes.
Can we replicate
Can we?
that with
Yes,
limited
yes.
resources?
Well, I think that's where Dorothy's level of expertise and then working with Jenna, like what she's saying, where I said, chipping off that iceberg. Like, where as we move into FY '26, do we want to be? So we'll see, right? We'll see. So
Yeah, 'cause if you-
anybody on the call too, like, we're interested in your thoughts, because we are looking to fill the room on June 20th with partners across the area to work with Dorothy, we're gonna be hosting it here, June 20th.
In this room?
Yes, with lunch, having her here all day to work through,
And breakout sessions?
Yeah.
What time does that
Yes.
start? Cause I was
Yes.
putting it in my phone earlier and I didn't see the time.
did she say yet? Is it a 9 to 5, 8 to 4? We don't know yet, but it's gonna
We
be
don't.
it's
It's gonna be all day.
it's gonna be a Friday. Yeah, it'll be
I got that.
June 20th. It's probably gonna run 9 to 5,
Okay,
but we
I'll
haven't,
just put 9 to 5.
we'll have
and
to
it
check
should
with
be
her.
an
She
email.
might want 8:30, 9:30, but it's gonna be roughly
I'm gonna
that
put
time.
8:30.
Right, and I really hope that we can get people that have varying backgrounds.
Yes.
Mhm.
We've created a list to kind of fill
Great, okay.
the 12 sectors.
Yeah.
That's something that we.
And the
And
TARP leadership
Mhm.
and the Wellness Coalition leadership, unless
And
those,
general membership.
and general membership will be invited to
Right.
attend.
Right, and Jenna, like with the Veteran Summit coming on Wednesday, right after the hour that is over.
We'll move on to that.
We are gonna
yeah.
be shifting our
Years, yep.
binoculars on that. And Jenna's been reaching out, as well. I think we put something in the newsletter. And again, anybody on the call, if you're not already on the list, like, we're looking to see who can commit to that day on that Friday. Because, we will be creating, other than some tweaking, the strategic model for FY '26. So, we hope anybody that, has a vested interest will come.
Hey, Kenan, this is Allison. I would love to come, if possible. I can try to see if I can get approval to come to that, if that's okay. I really thank you so much for this presentation, because all kind of the strategic modeling things are sort of like my bread and butter. Of course, my focus is at veterans and SMVF, but I have a couple of tools that, and I don't want to muddy the water because I know this was a lot today, but I can just share them in the chat, and just whenever you all get a second, if you're interested, you can review them. One is a strategy selection tool, and it talks a lot about kind of that feasibility and bandwidth piece that we were talking about. What can we accomplish? What can we have the highest impact with, while also being cognizant of our resources that we have currently. And then the next one is an action plan, and this action plan is centered around our 3 priority areas for VA suicide prevention. So identifying service members, veterans, and families, promoting connectedness and improving care transitions, and lethal mean safety. But it's really adaptable. It's an Excel spreadsheet, and it addresses a lot of the things that you were talking about, kind of figuring out what the issue is that we want to address, what strategies are we going to use, what's our goal, when are we going to revisit it, how are we going to measure those outcomes. So I don't want to like add more stuff, but I'll just put them in the chat, and if you guys are interested in looking at those, or if you have any questions, obviously I'm around to talk about it. But thank you so much for presenting.
Thank you, Allison. Yeah, that's actually our next meeting. So you're absolutely right. Action plan, and then also talking about how to build good outcomes and how to pick stuff like that. But yeah, send them in the chat and I'll add them to that presentation too. That'd be great. Thank you.
Perfect. Thank you.
This is Catherine. Does that strategic selection tool have anything to do with how we do that, like in a SWOT analysis?
It's not so much about the SWOT analysis, although I do have, the materials from the last SWOT analysis that we did. So I'd be happy I can drop those in the chat as well. It's more of a feasibility matrix. So we're looking at what's feasible and what's going to have the highest impact. And it's like a square, it's a matrix. And so you can kind of plot different points on that matrix to kind of help you visualize what might be sort of things to get started with, and what might be things that maybe down the road would be good to work on when we have more capacity.
Okay, thank you.
No problem.
I never asked her because I didn't know if we started.
Okay, yeah,
I really want people to be
I wonder
here
if
first.
Or not.
Okay, all right, so just let everybody know, we're not gonna be doing the hybrid on June 20th. Okay, is that what we discussed? Okay, I
Yeah.
heard you all.
Yeah.
Okay.
It is, that's good person.
So Allison, I hope you can join us, but we're not gonna provide the hybrid option.
Okay, no worry. I'll see. I don't mind a drive, so I just have to get cleared. So I'll ask them. And you said you think it's going to be 9 to 5?
Yeah,
So I'll go double check.
we'll double check that, but that's from my recollection, it's gonna start 9-ish, end at 5. I think it's on
Okay.
Allison, if you need an Airbnb, let me know. I'll offer mine to you.
Oh, that's so sweet of you. I have to be back in town for a wedding that next day, but I appreciate it.
To come for a Thursday night,
Oh,
but just keep it in mind.
thank you. Will do.
Any other questions? Thank you, Jenna.
Thanks.
Fantastic. All right, so moving down, moving down from that, update from, let's do leadership updates. Then we'll move into anything, right?
Yep, we can do that.
Okay.
Leadership updates, we did not have our monthly leadership meeting. We postponed that until June, the first Monday in June, where we will be reviewing the bylaw changes that the committee came up with, and then potentially bringing them to the next, coalition meeting, if they are what the leadership, committee, leadership team feels should be brought forth. Other than that, we're looking forward to this summit next week, and we are also looking forward to our training that we just discussed in length on the 20th of June. Elena, you have anything else you'd like to add? She might have had to step away.
Sorry,
Oh,
no, I am here. I'm just driving, but I'll be back at the office in a second. But no, I don't have anything.
Kenan?
Nothing, let's see. what I did have on here was, the readiness survey. The state of Virginia collected, close to 50 readiness, coalition readiness assessment surveys from members. We're really happy with that response. The link to that doesn't close until June 30th. So in addition to, the June 20th event, which Jenna will be working on, I will be working on reaching back to members who we don't feel responded to that coalition readiness assessment and asking folks, again, another opportunity to complete that survey of our coalition to try to really kick that amount of responses over 50, maybe closer to 65, 75 before that June 30th cutoff date. So we really appreciate everyone's participation in that. That went really well. That'll be closing down June 30th. All right, the next on the agenda is the ACES training that was scheduled for tonight did get canceled. Christine's gonna push that out by TARP later in the summer. I don't think we considered the fact that this is the last week of school for a lot of folks. I think most of the school systems are closing down, having graduations and ceremonies this week, next week. So we moved that. We also had a QR code for that training and we didn't get any QR code response, even though we put it on social media, our newsletter, and et cetera. I think it was May 15th, I think was just too loaded to go after educators this month. Which brings us to the summit. I'm gonna share on the screen and then pass around the room so you guys get to see the hard items. So if you're not already registered, please email Jenna and I, or you can register yourself through the link in the newsletter. Let me share with you, the SMVF Summit is ready to roll. We are super excited. Hope to see everyone at the Prizery Wednesday morning. You can see there, and I passed around the room the brochure. I'm sharing on the screen the inside of the brochure to brag on the amount of work that coalition members did on creating this event. We've got over 100 people coming on Wednesday, so super, super excited. So around the room, you're seeing the trifold brochure we created on the event. We created a booklet of all the speakers, so speakers' faces, their bios, and then also an evaluation. So, and you'll be able to evaluate the event two different ways. We have a hard copy evaluation that we're going to ask people to complete while they're there. And then we're also going to have a QR code available during the lunch table. So people have two different ways to complete the evaluation, because with expecting over 100 people, we would love to get 100 evaluations returned to us, so that given this nice response, we could possibly host the event again next year. The other item I passed around was the certificate. We were not able to provide CEUs, but we are providing folks with a certificate. And on the certificate will be a place for them to write their name. And then we will be handwriting in the date of the event. Again, with the idea that if there are any certificates left over, we could maybe use them again in additional outreach opportunities with local vets, their families, and servicemen and women. And of course, they're going to be getting a bag. Folks that are coming are getting a bag and getting items that we branded with the tagline, you bring more back home than your gear. So super excited. We've got, we just had someone call me this morning from Intercept Health out of Roanoke that wants to have a table. We've already maxed all of our tables. Jenna's got this fantastic map of the banquet hall. We've got all kinds of wonderful folks that are coming to table, wonderful speakers, as you can see around the room, fantastic people come in, breakout sessions. Jenna's been doing a wonderful job of reminding everybody that's been registering, since the summit doesn't cost anything, to please come. If you haven't already registered, we still have room. Please go ahead and email us or register on the link that you're coming.
Did you happen to ask the person who could table to come and network?
Yes, well, yeah, well, the folks that are coming for tabling,
We'll be able to.
yeah,
attend, right.
absolutely,
But no, you
absolutely.
said there wasn't room for the person who wanted. to
No,
come.
yeah, when I call this gentleman back, I'm gonna tell him I don't have space for you to set up a table, but definitely want you to come, absolutely.
Okay.
Yes, in fact, that's the same conversation we've had with about 2 folks. Yeah, and really good thing, we've got some calls from some local state agencies that aren't even based in our area, like in Richmond, Northern Virginia, when I went to the VACSB conference in Norfolk. Folks approached me and said, you're having a summit. I said, we don't have any more table room, but want you to come. Or also, we've got partners shipping us material. So that's something to mention too. So, your coalition table is probably not gonna look like it typically looks because if a partner shipped us materials to share, because that's what we do. We're a conduit to resources. We're gonna have, I mean, we've got tables after tables, and we're gonna be asking coalition members to help man those tables. So if people are picking up items, you can share where those items are from. Like we're getting stuff from NAMI, we're getting stuff from Mental Health of Virginia. Folks are shipping us stuff.
Nice.
We've got boxes and boxes in that 3rd office. We've got really great stuff. Yeah, that's a great question. Yeah, if they weren't able to table, come please. Oh, if I can't table, I'll ship you some items. We've been doing all of that. Yeah,
Awesome.
super excited. All
Should have
right.
known you had it well in hand.
Well, we don't like tell anybody no, that's
No,
always been my
exactly.
motto. Yeah, I'm like, oh, wait, no. And Jenna, hey, when you come up, you're gonna be table. We got the tables. We're setting the tables up Tuesday.
We got to
Okay, yeah, that was my question. So do you need any help setting them up? And if so, what time, et cetera?
Oh, yes. Okay, so we're able to get into the prizery the day before from 1 to 4 p.m. If anyone's able to meet us there, we would gladly take the help because we are going to set up the whole entire area. We are going to label every table with who is supposed to be at that table and range everything at the registration desk. Take all of our materials over there, lock and talk boxes, all the items. Jenna is creating name tags for folks who are volunteers. She is creating name tags for speakers so that we have those people marked so we can get them where they need to go. We're going to be turning over all the presentations of the speakers to the prizery, and then Jenna and I will also have laptops as backups. So the prizery is going to walk us through their fancy technology between the theater and the banquet hall, because we have breakout sessions throughout the day. So we're going to be doing all of that on Tuesday from 1 to 4. And then we're getting in the prizery as early as 7 on Wednesday morning, though we're not asking people to be there until 7:30. But again, if you can be there by 7:30, we're gonna have folks there rolling you in through the registration process and then rolling people up to the vendor tables and then getting our speakers familiar with where they're gonna be speaking and exactly how that's gonna work with the prizery staff. Am I doing a good job on that? Yes, I'm good. And we've got our caterer that's gonna be rolling in with us and setting up breakfast really quickly. So when folks are coming in at 7:30, checking in, setting up, folks also want to get breakfast, warm your tummies, and get ready for the day. Yes. And we do have folks lined up, coalition members, as well as folks here at the agency who are veterans, to be in charge of introducing speakers, sharing bio information. We've got a list of who is in charge of that, and if they pass out, who's next.
And I think we have a list of questions if nobody has
Oh, yes.
questions.
Also, very important coalition members, yes. In addition to that, we have also written questions for every speaker so that we have questions in the room. Because each of them wonderful people, Allison is one of them, who is coming to talk and share great information. We know there's probably going to be questions in the room for her question session, but just in case, we'll have folks in that room who will be tagged with asking really good quality, appropriate questions. Yes, to make sure our speakers feel supported. Any other ideas? And this is open time to talk about that. Anything you guys are thinking about as we get ready for Wednesday? We're super excited.
Hey, Kenan.
Yes, Amy.
So I've been to other events where they do a kind of raffle and everybody gets a card and they have to visit so many tables to enter the raffle at the end.
Would you guys be willing to do that? It kind of forces people to go find those tables and make a face-to-face contact.
I would provide, like a yoga gift type
Yoga
thing.
gift.
Like, well, it won't be, it'll be essential oils and that kind of stuff, something for well-being.
Do
I'd
you
be
have-
willing to do that.
Okay, do you have a sample card you could email me, Amy, that we could utilize?
Yeah, I could find one. They had one at the Danville Resource event, maybe 2 weeks ago. So I'll get it and send it to you.
Okay, I'll get it in front of my marketing person and see if there's a way Jen and I have talk about that.
Okay.
And that's a way to encourage people to come. And then, yeah, that's something we could talk about. Let me put that down. Catherine.
Yeah, I was gonna do that for the Infant and Maternal Health Summit and I decided not to. So if you wanna do something like that, that forces people to go, and if they can get their card filled, then they can be put in the raffle, and it'll probably be about $100 and some worth of stuff.
Okay,
It
And
won't
so-
look like it, but because it's essential oils, but yeah.
okay. And then we could do that raffle pull during the last panel session at 3:30 to
Yeah,
4.
Or
Okay.
during the
you
lunch,
could, you could
I
do
could
it.
do it,
Okay.
well, no,
All right.
because we want it to wait. You
You
because
want to
there's
wait
a
till
break
4.
afterwards, isn't there a break
No,
after?
the last session is the panel session from 3:30 to 4, and then it's over.
So let's
but
do
you
it before that.
We could do it at lunch, essentially, because lunch.
Yeah, but that doesn't get, will they
Well,
have
lunch is
time
our
to
time, yeah.
visit in the afternoon? You don't want them to be not visited in the afternoon.
Do it right before the last session.
Yes, that's what I'm thinking.
Okay.
Whoever said that, Elena, was that
That was
you?
Elena.
Where's the, let me look at the agenda real quick. Because we could work it for mine.
Sorry. Hang on.
No, I found the paper in the summer, I was just trying to.
Their last,
Say it was.
Okay.
the Actual.
21st, the 21st.
all right.
Do we have another break in there?
Here's the thing, we have, our last, let's see, the break is between 2:15 and 2:30. And then there's 2 sessions back to back. But, so we're saying, wait a minute, are we saying they want people to go after the 4 o'clock, or want people to go back
No,
up?
no, I'm saying after, maybe at the 2:30 point. Before
Okay.
that last session, because you'll have that break, they'll have it right
Okay,
at the
then they
end of
could,
that break.
okay, and then they're turning in their card in that break between 2 to 2:30, or between their walking, because they're gonna be walking between 3:30 and they're gonna, if folks that wanna leave the theater and go to the banquet hall are gonna be leaving from Josh's presentation and going to Sarah's presentation, they could walk by wherever you wanna put that drop off.
Okay, we can, yeah, and that's what I mean. What's the
Yeah.
last possible time they have to visit booths and tables?
And I would say 3:30,
Okay, so then let's
3:30
say
to
have,
4.
put it in there by 3:30
okay,
on the
okay,
draw. Or 3:15, whatever you want.
okay,
Okay.
Do you have to be present to win?
oh, that's a. Jen is nodding your head.
I mean,
yeah.
I agree. I think you should have to be present to win.
All right.
So Catherine, do you need me to send you anything or are you gonna take it on?
Catherine's gonna take on the raffle basket, but I'll need the sample for the cards if we're gonna have them.
Gotcha.
Okay,
Gotcha. Okay. Thank you guys.
thank you. That's a great suggestion. Thank you.
I like that idea.
Anybody else? That's a great suggestion. All right, so we're super excited. Please come join us on next Wednesday and then of course, June 20th. Couple other things to mention. So the Southern Virginia Problem Gambling Collaborative, which we are a part of, that covers both Danville Pit as well as Piedmont's area. So all the way up from Martinsville and Mount, area, all the way down to, not Mount Airy, what am I saying? Rocky Mount, I'm sorry. Rocky Mount, Piedmont, Martinsville, all the way down to Brunswick County. You all know that we are part of the, where'd it go? Where'd it go? We are part of, let me see if I find it here. Here we are, there it is. We are part of the Southern Virginia Problem Gambling Collaborative. I've shared it on the screen for you guys in the room. Our color printer has gone down. We're waiting on ink. You guys want to pass those around? Yeah, they're not colorful because our getting it fixed, but it died on this the other day. We are co-hosting with Danville, Pennsylvania on June 17th from 1 to 5 at the Institute for Advanced Learning. our Breaking the Cycle, a summit on addressing problem gambling. We'd love folks to come. All you have to do is register. There will be refreshments provided. It is no cost. Again, that's a collaborative between us and 2 other areas of Virginia. Let's see. And I distributed that throughout the room as well. And then as always, Revive training next Monday, the 19th. Oh, and then the RACEP conference. Oh, something I forgot. Here we go. So we are also working with Danville, Pennsylvania to support the RACEP conference. If you are interested in being part of that initiative, please let me know. I know that conference is in the planning stages.
Thank you.
If you would like to be involved in what's happening.
Thank you.
Yeah.
Thank you, church.
All right, so that's on August 27th from 9 to 4. Registration is currently open. Would love for folks to come out and support us that day as well. And that's again, another regional collaborative.
What is the RACEP conference?
That is
I must have missed that.
RACEP is the name of the
The organization.
the coalition in
Right.
Danville, Pennsylvania.
Ah, okay.
Right.
And what is their, what's their focus on that?
Marijuana. isn't it?
It was marijuana last year. Off the top of my head, I don't know, but I would definitely find out because we want to be a part of that,
Okay.
what they're doing regionally. Hang on a minute.
And that'll be emailed when that is as well.
Yes, it's August 27th. It'll be in I think it's in the monthly newsletter already.
I
Last year, the
put it
focus
in
was
my thing
marijuana.
already.
Let me find out what the
9 to
focus is
4.
this year. And we may want to pick a focus based on what happens with us on June 20th,
Right.
right? And
156.
approach them about what we could do in that conference connected to that.
Yep.
Okay. All right, hang on.
So it
Right.
won't necessarily be focused on marijuana this year.
I don't think it's gonna be the whole focus. No, last year it was the whole focus.
Okay, 'cause I thought that it would. And
And it might, I just don't know for sure.
you'll let me know
I
later.
will, I
Okay,
will.
good.
I didn't think so, but I could be wrong.
Cause I was deciding whether I wanted to go
I could be
because
wrong.
of that factor or not.
All right, so the floor is open for member news. All right,
Just a blurb from, I get a independent news thing dropped in my inbox every morning. This was just awesome. US drug overdose deaths dropped by $30,000, 30,000 people in 2024. 27% drop from 110 deaths in 2023 to 80,000 last year. The largest 1-year decline on record. I think that's just the coolest thing.
yeah, I heard that as well at the the governor's office is announcing
Clapping
that.
for that.
Yeah.
And don't forget all the Revive trainings that you all have been a part of over the last number of years. And I'm not saying by any means, that all the credit goes to the outreach we did with Revive trainings, but I
They
certainly
mentioned
think it's a part of it.
naloxone and going over the counter. They don't know why the drop was there. They also have expanded methadone in-home use.
Mhm.
Only all but 2 states saw a decline. Nevada and South Dakota had a slight uptick. So
Interesting.
something's
So I think we have
working,
made change. but yes.
something's working,
Yes.
keep doing it.
Yes,
Yep,
and we have been a part of that. We have been a part of that. Yep,
definitely.
absolutely. Thank you, Stephen.
Anything else?
Other member announcements?
So, Tri-County is once again hosting a karaoke night because I love karaoke, so I talked my boss into letting me host it. So, we are doing a karaoke night for support for hunger and homelessness. I just put the flyer in the chat. It will be at Badeau's Seafood Grill on June the 7th. It's a Saturday from 8 to 11. Alcohol and food will be available to purchase from the restaurant. The entry fee is 5 non-perishable food items, which will be distributed within the community, or monetary donations if you're feeling so inclined, which would go to support a homeless family or to prevent a family from becoming homeless. So I hope y'all come, listen to me sing Journey.
Thank you. I'm glad you dropped that in the chat box. Good, because I was just getting ready to ask for that. All right, other member announcements?
I just wanna know, is, Kenan, are we gonna sing again at that karaoke night?
Oh,
Are you saucing it? Never mind. Not appropriate.
but unfortunately, I'm gonna be out of town that weekend.
Unfortunately.
I know, I'm serious, I'm serious. Some folks that I used to teach school with up in Northern Virginia are having a get together and I'm gonna go see some.
Tell us tales.
Oh, I'm just, no, I'm.
That was a quick
I'm
one, that was
bragging.
good, that was a
No, it's
quick one.
true. We're having it.
Something we can't immediately.
You know, I used to teach public
Exactly.
school before Bobby was born
Let me
in
get
the
on
DC
there.
area. And a bunch of the teachers I taught with over 25 years ago, we're all getting together actually on that day, yeah, in Occoquan. And we haven't seen each other in 25 years and they haven't seen Bobby since he was 3. So, no, unfortunately, no. As soon as you go that day, I was like, oh, I'm gonna be in Northern Virginia. I'll post pictures so y'all can see.
Proof.
Anybody
Yes.
else have any?
Yes.
Make sure you're holding a newspaper and a picture with a date on it. so we
Yeah.
can verify.
I know. When you see people you haven't seen for 30 years, you're gonna go, what are you gonna look like, right?
Kenan,
What are
did
they
you
gonna
want to share the coffee with legislators information? I know Catherine and I are planning to go to that, but if anyone else wanted to go.
Yes.
Tammy, Mulcahy, and,
Tommy Wright.
are going to be at the,
Uh,
event with the chamber in Halifax.
At
And
the
they're
SOVA
hosting-
Innovation Hub.
yes,
And they're gonna
What
be,
is that?
we'll be attending, Elena and I will be attending that to rub some elbows with them and get some of our, concerns to the forefront if we have the opportunity.
and I've reached out to
It's a
Mitzi
Q&A.
at the
It's a
chamber
Q&A.
to get your seats reserved. I've to check my email. I haven't heard back from her yet, but I was gonna give her this morning, and then if she hasn't responded, I'll call her and secure y'all seats, because we are members, the
Right.
coalition are members of the
Right. So if
Halifax
there's
Chamber.
anything that you have, any of you, and you want to give us a question, or if you have a comment that you feel should be brought forth in front of those two folks, one's a senator and one's a rep in the state of Virginia, so in this area. So I think it's a great opportunity. So please either email Elena, me, or Kenan, with any questions, concerns that you might have.
And
And we'll see what we can do.
Thank you, Catherine and Elena, for going.
Yes.
Really appreciate it.
That's morning breakfast. Oh.
Yeah,
Yeah.
but that's really awesome that the coalition's getting out there and doing stuff like that. So thank you guys so much.
I'm really excited about it.
Okay, all right, great. Announcement. Anyone else? Last reminder, if you have time on Tuesday, please join us at the prize room from 1 to 4. If not, we'll see you starting at 7:30 to 7:45 on Wednesday morning at the prizery. I'll come out to support our efforts around service members and veterans outreach.
And please register if you haven't.
Yes,
Please register.
Even
Yes.
if you're a vendor,
Yes.
even if you got a table, you gotta register.
Yes.
yes. All right, so we're adjourning at 11:09. Thank you all. Thank you so much for joining us.
Thank you, everybody.
Thank
Bye.
you. And bye.
Thank you.
Brian, you are quiet today.